Still questions tonight about how the state will track COVID-19 cases at childcare facilities. The Texas Health and Human Services Commission just launched a website to collect positive case data from daycares and school programs across the state. KXAN's Jennifer Sanders explains how the system works and what challenges exist.
In just a few weeks, the doors will open here at Mainspring Schools. For many parents, the concerns are a lot different this time around.
When we speak to them about their concerns about coming back and the environment in general, their number one question is what are the precautions that are being put in place to protect their child?
Executive Director Jason Gundel now has an extra layer of reassurance for parents. It's public data on the Texas Health and Human Services Commission website with a breakdown of self-reported cases from child care centers and before and after school programs across the state.
Having that data be public is important, and that's not only for families and their children, but also staff, and making sure that there's full transparency within the organization and outside the organization.
Here's a quick snapshot of the 6 centers and programs that reported data in Travis County. Since March, less than 80 employees and less than 35 enrolled children had COVID-19. Kathy McCourse, who is part of the Austin-Travis County COVID-19 Child Care Task Force, says the data is promising. Transparency is also key.
But we do see that it's typically impacting adults more than children. And in most cases, there's only been 1 or 2 cases in a child care program since March.
But there are some challenges. Some daycare providers worry about the stigma and the trends surrounding positive cases.
We don't have a good way of really comparing when we see cases. Do we know what those child care programs were doing to mitigate risk?
In Austin, Jennifer Sanders, KXAN News.
It's important to note that the data on the Health and Human Services website also reflects that fewer children are enrolled in daycares since the onset of the pandemic. We did reach out to Texas Health and Human Services. A spokesperson tells us child care providers should alert the agency as well as parents, their local health authority, and DSHS of any cases. Providers should always follow the specific guidance of their local health authority.